sock like that and open it up and slide it over. Pull it up. Okay, set up. Okay, and bring your leg back down. And now do the same thing with the other side. Good. All right. Now, Laura is very nimble. Okay? She flexes really well, right? Now, if you get me, I'll tell you right now, I don't flex real well. And you need to ask me or anybody else who may be of a larger size, how do you get your pants on and your socks on at home? And I would tell you, I bring my leg up onto a surface, and then I can do it. Okay? Now, you would do this with a neuro patient. You obviously would not do this with like a hip fracture or a spinal patient. That's a whole different ballgame. But for a neuro patient, get their leg up. And you really got to get the leg up to the ankle up on the bed. And you see I'm sitting kind of cattywampus here. I'm not sitting straight. So be aware. You're going to work with thin people, large people. You're going to need to adapt your style based on what they can and cannot do. And most students try and throw adaptive equipment in there. And sometimes that doesn't make any difference at all. Okay?
Especially with the swimming, because they only have one hand to use.
Only one hand.
On the adaptive equipment, how do you get the clothes on?
Exactly. Okay? All right. Let's get your shoes on next.
Match your jam.
She is color coordinated. All right. I did show you the video, the one-handed shoe tying, right? So we would need to set her shoes up to do that.
Right.
Or we'll just take this. We'll have them tied. Do these slide on fairly easily?
Yeah.
If I do this? All right. Keep them tied. I pull the tongue through. Okay. And the reason why I do that is so that when I drop this, or she drops it on the floor and goes to slide her foot in, the tongue doesn't end up by the toes when she brings her foot in, right? So we're going to bring that up. Actually, wait a minute. Bring your foot back up again. Okay, and now slide your shoe on. Now she's got some, all those little movements that you need to do. Your patients will not have those little movements. It's going to take them much longer than what she just did. Can you pull the tongue? Is it a good spot?
Yeah.
And then she can just wear them like that if she chooses, or she can pull the ties out. Okay, bring it down. Okay, I'm going to have you set up the other one this way. The other option, what other options could we give her if she just gets, this is just way too frustrating for her? Slip-on shoes. Now with slip-on shoes, you want something with a back. You don't want like a Birkenstock or a flip-flop or anything like that. They're using their toes to hold those on, and their balance is off. Okay? All right, let's get the other one.
What about Velcro?
Velcro would be good too. Yeah? Good. Lovely. All right. Ta-da. Let's grab your shirt. Now we've got a button-down shirt here. There's a couple ways we could do this. We can have it so that it's going to go over her head, right? So I'm going to just unbutton the top button. Okay? Or you can unbutton all and then work on the other direction. All right? Again, weak side goes in first. Affected side goes in first. So what I'm going to tell her is, Laura, I want you to set up your shirt. Oops, be like you. And demonstrate for her. Take her clothes and kind of demonstrate. I want you to take the arm so it kind of hangs over. Okay? I want you to grab your affected arm, place it in your lap, lean forward a little bit, and then pull it up your arm. Okay? Uh-huh.
Backward.
Uh-oh, it's backwards. Pull it up. There you go. That is good catch. Well, it would have been. And if you're working on clothing orientation, you would maybe stop them and say, okay, what's wrong with this picture? Versus just telling them. Careful. Don't beat yourself up. Not that bad. You're doing a fine job. Okay? And now get your other arm in and bring this up past your elbow. And then bring it up over your head. All right. I want you to make sure you reach all the way around or reach down around the front. Make sure it's down on both sides. It's the same thing when they pull up their pants. They may pull up half their pants, but the other cheek is still hanging out. So you need to say, okay, I need you to feel back there and feel that other side. Do you like your collar up or down?
Pop it up.
And with that one hand, can you button? Ta-da! She's all dressed. Okay. To get her undressed with the top, okay? So let's have you unbutton just the top one. And the easiest way to do this